Hello, my name is Dr. Jeffrey Weiss. This is the third podcast of Medicine Confidential, where we go behind the scenes about what's really going on in medicine. As I previously said, since I've been practicing medicine over the last 40 years, the quality of medicine has decreased. Doctors, many of whom are employees of hospitals, are rushed. Private equity groups have purchased practices and cut staff, so you're on hold a lot longer. If the call is ever answered, you wait a lot longer. It's difficult to get your test results. Um, Today's episode is to talk about insurance companies. Now, it's better to have private insurance or Medicare. Why? You want to pick the restaurant that you go to. You don't want to be forced to go to only a particular restaurant. Because what happens then? They know you have to go to them. Are they going to care as much about giving you the best food? It doesn't matter. You're stuck. You have to go to them. Whereas private insurance or Medicare, you have the choice of going anywhere you wish. So hopefully you will get better care. It's not always the case, but at least intellectually, you would assume that you would get better care because you have a choice. When you have no choice, you're stuck. Now, as a practicing physician for many, many years, I have found that the HMOs are particularly bad. The more flowery the name, Gold Plus Plus, Advantage, Super, Platinum Plus, the more flowery the name, the worse the care. Because the bottom line is they're getting a certain amount of dollars and they're a for profit company. Even if it's something that's considered nonprofit, they still have to make money. And if you look at many nonprofits, their CEOs make tremendous salaries. There was one particular nonprofit that they held a banquet for their employees and spent hundreds of thousands of dollars. So just because it says nonprofit doesn't mean, oh, now they're caring about you. During my time practicing as a retinal specialist, I saw patients on HMOs who had dense cataracts and they would be referred for glasses. They couldn't have cataract surgery. Why? Because the ophthalmologist didn't get paid enough to do the cataract surgery. So he would say, oh, the patient needs glasses. There was one particularly heinous case where I saw a woman in her 40s and I made a diagnosis of reticular sarcoma, which is fairly rare but leads to death. And she needed an MRI of the brain, and her primary doctor refused to do it. He had never heard of the diagnosis. I sent him material from the textbook about the diagnosis, and he never heard of it, didn't want to do it. Why? Because he gets a bonus if he saves the HMO money. And ordering an MRI would cost him money and a bonus. I wrote to the insurance company, told them what was going on. Next day, I got a certified letter. They dropped me from the insurance company. And I called the patient's husband, who was an attorney. And he said, well, they're supposed to pay for it. I said, yes, but they're not. You need to get it. Unfortunately, the bottom line is 6 months later, I heard that she had a convulsion at her home, went to the hospital, and died. And she was in her 40s. We have all seen cases of people with hemorrhages in their eyes, and the HMO won't authorize an ultrasound exam, or I need to refer the patient out to somebody in their system, and they send the patient 40 miles away to somebody because he's cheaper to do the ultrasound or another test. Um, I tried to get speech therapy for somebody, and they made an appointment with somebody 70 miles away from where this elderly person lived. You always have to look at intent. If somebody who loves you criticizes you or makes a suggestion, you understand that they love you and they care about you, and their suggestion is to help you. Obviously, if somebody who doesn't like you is always criticizing, you don't pay much attention uh, to them. That's why intent is important. Well, how can an HMO give you over the counter items and free transportation? It comes from the same pot of money that they're receiving. So, which means the doctors are getting less. And that's the one guy you want, that he should be paid enough to do something for you. He may say, oh, no, no, you shouldn't have this procedure. Why? Because he knows your insurance doesn't cover it. Not that you shouldn't have it. You should have it, but his insurance won't cover it. Or if he has to order particular testing, it comes out of his bonus. So he won't order the testing. The bottom line is that there's no such thing as a free lunch. You don't get something for free. However, healthcare is ridiculously expensive. Private insurance is very expensive and getting more expensive. And if you have no choice because you can't afford it, then you have to be on an HMO. I mean, you have no choice. You must have health care, because to show up at the hospital with no health care, um, my friend was playing basketball, didn't have health care, and went to the hospital with chest pain. He had one stent put in. The doctor who put the stent in got $600. The hospital bill was $120,000. He was there overnight, 23-hour admit. I mean, that's insane. Obviously, you negotiated it down, but still, it was ridiculous and very, very unpleasant. So you must have health insurance. Um, Now, Medicare gives you the right to go anywhere you want. Now, some of their regulations are kind of silly. For certain rehab equipment, they only pay for it every 5 years, even though the particular item may last 1 year or 2 years. Or in a growing child, the child's growing. After a year, it doesn't fit anymore, but their rules are 5 years. Trying to get straight answers from anybody is next to impossible. There's nobody to speak to, or they'll tell you the wrong information unless they hang up on you a few times while you're on hold for an hour. Um, One thing, when you go to the hospital, um, you go to the emergency room. Now, at one hospital, I know the name badge has a chip in it, and the emergency room doctor is timed, and they don't give him much time. So we were all told that the physical exam and taking a history is incredibly important. That tells the doctor what the possible problem is. But these doctors don't have any time for that. And so a lot of people get admitted to the hospital who shouldn't be admitted to the hospital. And now you're stuck with a hospital bill. Now, it may be that you went to that particular hospital because it's in your network. But the problem is the doctors may not be in the network. When I was in the hospital, I got a bill from the surgeon, which I expected, and from the hospital. But then there were all these other people that were sending me bills. I didn't know who the hell they were. And trying to figure out the bill was next to impossible. It's not itemized. They just say insurance didn't pay, or this is what you owe. Did they bill insurance? That's another little thing I need to warn you about. You give insurance cards, and let's say you have something in Medicaid. Well, they don't want to bill Medicaid because Medicaid doesn't pay. So they purposely don't bill Medicaid. And then you get a bill saying you owe that money. It's not itemized. You don't know what it's for. You need to find out, did they bill Medicaid? And then they'll say, oh, we didn't have the card. You know you gave the card. There's all kinds of tricks. It's very difficult to see what the bills are for. Much like some of the cable companies, they have all this garbage on their website, and all you want to do is find out why your bill is so high, and it's very, very difficult to navigate the stupid system to try to find out what they're billing you for. And whenever I see that, it's because they don't want you to know what they're billing you for. Now, there's a lot of advertising I see, top 10 hospitals. And this is particularly humorous because one of the hospitals I know is terrible. I looked up what they meant, and it was they were in the top 10 for medical record completion. I can't make this up. Do you care as a patient when there's a big sign in front of the hospital, top 10 hospitals in the US? You think, it must be a good hospital. It's in medical record completion. That doesn't help you. So that's, and this particular hospital is rated as the worst customer service in the whole hospital chain, but it's also the most profitable with good reason. Now, it's very important that your doctors, give a damn about you, and you need to have other people around. Depending upon what state you're in. I'm in Florida. There are very high malpractice costs here, among the highest in the country, like New York, California. Doctors won't take risks. Now, if you have a chance, if you're going to be dying and there is a procedure that they could try or a treatment that might save your life, wouldn't you take it? I mean, it's like if you're in a car with no brakes heading towards a cliff, would you sit in the car knowing that death is certain, or would you jump out? Well, in states with high malpractice risk and cost, where a lot of the doctors don't have insurance because it's too expensive, you might pay a couple of $100,000 to get $250,000 of insurance. They won't take a chance. So this high malpractice and all this liability crisis does affect you as a patient. They won't take a chance. Let me ask you this. Would you? If you can do something and maybe it works, maybe it doesn't, but then you can have lawyers suing you for millions of dollars that you have to pay for personally. So it does affect you. It affects all of us. It affects everybody. Now, I have previously alluded to the fact that how doctors are very unhappy. And I did write a book called Physician Crisis. It's on Amazon. It's published by Springer. And you can look at that. By the way, I'm not going to be hawking any supplements or any other drugs, and there won't be any special effects or anything. Certainly, if there was, I would Photoshop some extra hair up here. But you're just going to be hearing the truth from me, in my opinion. So thank you very much for listening to this, and I'll see you next time.